Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Your kidneys perform several critical functions. They clean your blood and support important bodily functions. When your kidneys cannot perform these functions, treatment is needed. Whether you know someone with kidney disease or have been recently diagnosed yourself, this show is for you. I'm your host, Janet Whitmoyer. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I would like to welcome our first guests who come from St. Peter's Hospital, Dr. Rob LeClaire, who specializes in nephrology, and Alice Luer, a dialysis unit nurse who is also the home therapy nurse. Thank you both for coming. I'd like to start with you first, Dr. LeClaire. We hear often that nearly 1 in 3 people with diabetes and 1 in 5 people with high blood pressure have chronic kidney disease. Can you start off by telling us a little bit more about what chronic kidney disease really is?
Well, chronic kidney disease is a condition where your kidneys do not clear the blood as effectively as they should. And there's various different levels of kidney dysfunction one can have. We talk about stages or classifications of CKD, chronic kidney disease, stages 1 through 5, 5 being the worst dysfunction that the kidneys may have. Whether with kidney disease, whether you're going to have progressive loss of kidney function over time, it depends on the type of disease. So some people will have some degree of kidney dysfunction where their kidneys are not clearing the blood effectively, and that may not get worse. And then other people, there may be progression, and those are the people we're concerned about, particularly people with diabetes.
Okay. What if a person has untreated end-stage kidney disease? What can happen to them?
Well, if it's untreated kidney failure, which is not as common as kidney disease, fortunately, those individuals, if they're untreated, can die from kidney failure. And that's our biggest concern, is that someone could pass away from kidney failure itself. Kidney disease, on the other hand, they are at risk for other complications, such as cardiovascular complications, such as stroke or heart attacks. They're at a higher risk than other individuals who do not have kidney disease. But the biggest concern with kidney disease is that some people who have kidney disease could have progression to the point where their kidneys do fail.
Okay. So there's obviously some options for people who have kidney disease and end-stage renal disease. What if a person who has end-stage renal disease chooses to do nothing? Is that the problem where they will eventually die?
So you're right, there's various different options people have if their kidneys are failing. And one of them is actually to do nothing at all. That is a choice for the patient, and with a discussion with the physician, usually a nephrologist. And for some people, because of their age, because of other illnesses that they have, they may feel that it's not right for them. If they decide not to do dialysis, people can actually live for quite some time with kidney failure. It just depends on how fast it's progressing. So if it's progressing slowly, some people can actually live for years sometimes with severe kidney failure. Other people may pass away within weeks or months.
Well, that's great information to have. Also, transplants are an option for some people. Can you tell us a little bit about a person who would choose a kidney transplant? What actually happens with that?
So just to make it very clear, the standard of care for people with kidney failure is transplant.
Okay.
So that is the standard of care, and that means that that's what we should be striving for every patient who has kidney failure. If they are a candidate. So some people have other illnesses that preclude them from to having a kidney transplant. Someone who may have cancer, someone who's very ill from other illnesses, and people who are advanced aged. Some of those people would not be a candidate for transplant, but anyone who's a transplant candidate, you really want to encourage them to go on and have a transplant if possible. If someone decides to go in to have a transplant, you have to be evaluated by a transplant center. We do not have any transplant centers in Montana, but there are fortunately a number of transplant centers in the Northwest area that are very happy to take people from Montana and evaluate them for a transplant and have them transplanted. In fact, from Helena alone, we've had 6 different facilities transplant our patients in the last 3 years.
Wow. And so you work with those facilities out of state to actually get the person set up for the transplant and they come back?
Absolutely.
How long do they usually stay out of state before they can come back?
It's usually about 3 to 4 weeks.
Oh.
And most of it is outpatient.
Okay. So I wanted to also talk a little bit to you, Alice, about the other option for people with renal disease, and that's hemodialysis, or hemo or peritoneal dialysis. Can you tell us a little bit about what happens if a person does decide to do dialysis?
Well, there's several different options for dialysis. A person can choose in-center dialysis, and that is a set schedule. So they either come in on a Monday, Wednesday, Friday, or a Tuesday, Thursday, Saturday at a set time. They go into a dialysis facility, trained staff then manages their dialysis treatment. The other option is a home therapy option, and there's 2 different types of home therapy. They can do either home hemodialysis or home peritoneal dialysis. And the patient and his or her care partner are trained how to manage those treatments at home. Now, obviously, a person that chooses a home therapy has much more flexibility in how they are actually managing that treatment. We give them, we want you to dialyze. For peritoneal dialysis, they dialyze every day. For hemodialysis, they will have a set number of days we want them to dialyze in a week. And they can choose the time that they want to do it. So it works really well for them. Quite often, people that choose home therapies feel a little bit better than those that come in center, because home therapy, since it's more frequent, more closely mimics real kidney function.
Okay, awesome. Great information and great options for people with end-stage renal disease. We'll be back right after the break to talk more with Alice and Dr. LeClaire about end-stage renal disease and more on kidney function. We'll be back right after the break. We're back with Dr. LeClaire and Alice Luer, who both work with dialysis at St. Peter's Hospital in Helena. We're discussing kidney disease. So I want to continue with you, Dr. LeClaire. Can you tell us what the contributing factors are that can cause kidney disease?
Well, the most common cause of people developing kidney failure is actually people with diabetes. Unfortunately, only a small percentage of people with diabetes develop kidney failure requiring dialysis, but about half the people who are on dialysis at any time are people with diabetes. The other causes of end-stage renal disease or kidney failure are hypertension that's usually poorly controlled, and there's a myriad of other diseases that can cause kidney failure, including things like polycystic kidney disease, which is a genetic disorder, or various different inflammatory diseases, autoimmune diseases such as lupus can cause kidney failure as well. The goal is try to prevent the progression in any of these diseases by treatment that's tailored for those particular disease states.
Okay, so what can people do who have these various conditions to actually help protect their kidneys?
The most important thing is blood pressure control. Because the tools that we have available to help protect the kidneys are somewhat limited. Diabetes control is very, very important as well. And so those are the things that I, as a physician, focus on, particularly people with diabetes and hypertension. The other disease states, it depends on what disease state it is. And sometimes we are able to use medications which suppress the immune system and potentially keep people from developing kidney failure from these diseases. Hopefully in the near future, we will actually be able to treat people with polycystic kidney disease so that they don't progress. That is a significant subset population of people on dialysis. It would be wonderful if those people didn't progress.
Okay, Awesome. Alice, from the nurse educator perspective, what tips could you give people to help them to keep their kidneys as healthy as possible?
You know, it all goes back to the basics. So healthy diet, healthy weight, and then just healthy lifestyle. If you smoke or use tobacco products, you need to stop using tobacco products. They're just, you know, they're vicious on the body. So overall general health of the body, if a person has overall general health, then usually the kidneys are a lot happier too. So other things, certainly manage your disease states like hypertension and also diabetes. And one of the big things on that is for hypertension is sodium control. You don't want to take in more than about 2,500 milligrams of sodium a day, which is not much sodium, especially if you start looking at labels. You'll see how much sodium is in our processed foods and in our canned foods. So sodium control is an important part of my training I do with somebody if they have hypertension.
So, and you said weight control. Do you have people actually needing to weigh themselves every day, or is this something that is really kind of tailored just to each individual person?
It really needs to be tailored to every individual person. Certainly a person that has end-stage renal disease and is on dialysis, we want daily weights on them because that is how we figure out what needs to happen during their dialysis treatment to get them back to a weight where they don't have fluid overload in their body.
Okay. So, and a lot of times when you're working with people, they obviously know they have kidney disease, and so you know they know what really they need to do. What do people who may not know that they have kidney disease, what would they need to know about what to look for kidney disease? So
as Dr. LeClaire mentioned, there are the 5 stages of kidney disease, and a person at stage 1 through 3 may be totally asymptomatic and not have any symptoms at all. And where their kidney disease is noticed is during an annual physical exam with a routine lab work that's done. And then it's up to that person's primary care provider as to how they want to treat that kidney disease. They can choose either watchful waiting, where they recheck the lab within 6 months, or at the next visit. And if those levels that they look for in the blood, which is usually creatinine and BUN, stay stable, then they may choose to do nothing at that time, just watchful waiting. If a person is progressing along the way, if they get to stage 3 or 4, they may start having symptoms like loss of appetite. They may be very fatigued, but they can't sleep when they go to bed at night. And those people should be referred to a nephrologist just to watch so that they can get on the appropriate medications to help prevent any further progression of that disease.
So by the time they get to you, it's a serious condition and something that we know we need to do something about. Is that a fair assessment, Dr.
It's, as a nephrologist, I have a range of patients who have either relatively normal kidney function to very severe kidney function. And obviously, it's quite depressing when I see someone who has advanced kidney disease and I have to tell them that you have advanced kidney disease. It's similar to telling someone they have cancer at that point. But for the most part, most people that I see, fortunately, are in the stages of 3 to 4. And one thing that I think is really important that people realize is it's not so much for me as a nephrologist, it's not so much your kidney dysfunction when I see you. It's really, do you have a progressive disease? And that's where things like a simple test like a urinalysis, where we're just looking at your urine, can be very informative for myself and for the patient to sort of have an idea of, is this a disease that's going to get worse? Or is this a disease that just simply you have some scarred kidney and it's just not cleaning the blood as effectively as it should? Clearly, everyone's biggest concern is that the kidney will get worse and you'll get to the point where you need to have some type of dialysis.
Okay, great. This has really been good information, and I think we'll be back right after the break with more with what happens after you've actually been diagnosed with kidney disease. Stay tuned. We're back with Dr. LeClaire and Alice, who are going to share more information with us about kidney disease. Again, Dr. LeClaire, I'll start with you. What happens when a person is diagnosed with chronic kidney disease?
The first step is to determine why they have kidney disease. And that's critical because it will, from that point on, you make the decision whether you're going to do something or nothing, or that person needs further workup. Because the most important thing is, do they have something that could progress? And so that's my job, is to determine, is it something that's going to get worse and we need to figure out what it is? Or is it something that maybe just simply scarred kidneys and this is just how, they may have just mild kidney disease because of that? That's the number one. That may require, besides a lot of blood work, a kidney biopsy.
Okay. So what would you say to a person who has chronic kidney disease are the most important questions for them to ask of their healthcare providers?
Is this going to be progressive? Am I going to need dialysis at some point?
Okay.
What can we do about it to keep it from getting worse? Okay. Do I have other options? Do I need to have further testing? These are all very, very important questions, and I would highly recommend anyone who has kidney disease to read up on it. Okay. We have plenty of information on the internet that's available to people, and if you ever have questions and you're not seeing a nephrologist, it's always appropriate to ask for a referral.
Okay. And you spoke of dialysis. I'd like to turn to you now, Alice, and ask you to tell us more about the types of dialysis and a little bit more actually about what people can actually expect with dialysis, either hemo or peritoneal.
Okay, so the one thing that's really important, if somebody does have stage 4 or 5 kidney disease and they're looking at needing dialysis, they really should go to a pre-dialysis education class, and then they'll learn the different treatment options. So one of the options is in-center hemodialysis, and for that a patient goes into a dialysis facility and then dialysis staff manage their hemodialysis treatment totally. The patients have an option. It's a very rigid schedule. They either are on a Monday, Wednesday, Friday schedule or a Tuesday, Thursday, Saturday schedule. Treatments are usually around 4 hours long, and the total time that the patient is in the dialysis facility for that treatment is around 5 hours. The other option that is certainly, if you asked most nephrology professionals, they would say we want to do a home therapy. So that's the other option, is a home therapy. And there's 2 different types of home therapy. We have home hemodialysis and also home peritoneal dialysis. Home hemodialysis is obviously a little bit more intensive training-wise than home peritoneal dialysis. In home hemodialysis, there's a special machine that we send home with the patient, and it's about a 6-week training process for them to learn how to manage their treatment at home. Home therapies, home hemodialysis are done more frequently per week than an in-center treatment is. The minimum is usually 4 days per week, and they can go up to 7 days per week also to be doing their dialysis. The length of time is, if they do more days per week, the length of time of their treatment can be as short as 2 hours. And the patients are trained during the training process how to put needles in their specially created dialysis access, and then how to initiate your treatment, how to monitor the treatment during the actual treatment process, and then how to terminate the treatment at the end. So the machine is very user-friendly. There's only X number of buttons you can push on it, so there's a set process that they have to do if they do have an alarm. There's a set process they do to clear that alarm. They are well trained on how to manage alarms, and their care providers are also given a lot of support too. And one of the best things to do to have a successful home program is to have staff that's very willing to dedicate themselves to that person's success. So we're really fortunate at St. Peter's Hospital is we have 2 nurses that do the home therapy, and we carry a phone 24/7, and we encourage people to call us all the time. If they have any questions at all, they call us. And there's been times where I'm on the phone, on speakerphone, driving in my car out to somebody's house in order to help them with their treatment. So we're really dedicated to make them successful at home. The other option is home peritoneal dialysis, and a permanent catheter is surgically inserted into the abdomen. And then a patient does what's called an exchange to help to do their dialysis treatment. So there's a special dialysis fluid that's instilled into the abdomen, and then it's allowed to dwell in there. And then as it's dwelling, the toxins and excess fluid move through the peritoneal lining into that fluid. So the dwell could be anywhere from an hour and a half up to 3 hours long. At the end of that dwell, the patient drains that fluid out and then puts clean fluid in, and then the process is restarted over again. There's several different options of doing home peritoneal dialysis. They can do those exchanges that I described 4 times a day, where they actually manually connect themselves, instill the fluid, disconnect themselves, walk around during the dwell phase, and then repeat that process 4 times per day. The other way they can do it is with a cycler at night, which is really slick because then that machine does all those exchanges for them. Obviously, the people that do the nighttime exchanges and on the cycler at night have their days free, so you know, the impact on their life is less than what it would be if they're trying to do manual exchanges during the day.
So just one quick question. Do you prefer, or is it the patient's condition that dictates if they're going to do peritoneal or hemodialysis?
There's a little bit of patient condition. So if somebody's had a lot of abdominal surgeries, or if, say they've had cancer, or they've had some sort of process that has destroyed their peritoneal lining, they wouldn't be a candidate for peritoneal dialysis. But they certainly are a candidate for home hemodialysis.
Oh, this has been great information. I'd like to thank both of you for being with us today. And I want to thank all of you at home for visiting with us today, and remind you to stay fit, stay well, and stay healthy for life with Healthy Living for Life. We'll see you next week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.